Well, welcome everybody. Thank you for joining us, our third webinar in our webinar series this year. We're very excited. We've got a jam-packed agenda as always. Just a quick reminder again, we are recording this webinar, so please do keep your microphones and cameras off if you don't want to be recorded, and you can use the chat or the Q&A section for any comments. So our agenda today, we're going to start off with Shannon McNee from CARGOM, who will be speaking about a recent report they've done. Then we're going to move on to Murray Davis from the Viewpoints Organisation with Robin Elliott from East Lothian Council speaking about the My Story app. Then we're going to come on to our very own Nikki Cronin from the Care Inspectorate and Peter, who was speaking about the pain share pilot they did, some really interesting information. And then I'll give a quick brief update about the Digital Innovation Hub before we go on to Q&A and talk about some evaluations. So I should have done introductions. I apologize. I'm Candice Aitken. I'm the Digital Improvement Advisor on the program. My colleague, Nikki Cronin, is our Senior Improvement Advisor. And we joined with Lynn White, who's our Support Officer for the improvements in the Care Inspectorate. So Shannon, are you there? Are you ready to take charge?
Yeah, that's great.
So yeah, thank you very much. Over to you.
Brilliant, thank you. Morning, everyone. My name's Shannon McNee. I'm the Digital Inclusion Development Manager.
You're on mute there, Shannon.
Oh, am I?
No, I can hear you, Nikki. You're on mute now.
Yeah, sorry, I couldn't hear. I need to sort my own audio. Apologies, Shannon. It's
just everybody want to just do a shout out in the chat if they can't hear, if it's just Nikki. Thank you.
Off mute, so hopefully it's okay there. Is it coming through okay? Yeah, cool, that's great. Thank you there, folks in the chat. So yeah, I'm Shannon McNee. I'm the Digital Inclusion Development Manager at CARGOM. And I'm here to talk about our latest report, Bridge or Barrier, Attitudes Towards Digital Health and Care and Frontline Social Care Services. Can I have the next slide, please, Lynn? So firstly, just a wee bit about who we are, if you've not heard of CARGOM before. So we are a leading social care and community development charity, supporting over 4,000 people each year across Scotland. Back in 2021, we launched our digital inclusion research project, which was really looking to learn more about the digital needs of people we support and our frontline staff to make sure everyone has the choice and opportunity to get online in a safe and meaningful way if they want to. Next slide, please. And for us at CARGOM, really digital inclusion is a fundamental human right, and we're working towards our kind of overarching goal of embedding digital inclusion across all of our frontline services and really working towards digital inclusion being respected and recognised as a real kind of marker of high quality social care support. And my next slide kind of goes into a wee bit about how we do that. So can I have the next slide, please, Lynn? So what we really try to focus on at CARGOM is the fact that we're already in the lives of hundreds of people each day who are at significantly increased risk of digital exclusion. So whether that is older people receiving home care support, whether that's people living with long-term conditions and disabilities, or people living in poverty, experiencing poverty and homelessness. We really ask the question of how we can use digital as a tool within that existing trusted relationship to really support someone to meet their needs and achieve their goals and outcomes. So it's not seeing digital as being something separate, as an add-on or an extra, but really try to work it into the core support we already provide. Can the next slide, please? And this just kind of shows a wee bit of the process about how we do that. And it looks different for each person, but really what it comes down to is finding that hook, that digital hook, the one thing or a combination of things that helps someone see the benefits in getting online, and then working with that person to set up a personalised plan. So that's going to look different for everyone. It could be working towards independently using a device and the internet, or it could be just asking the question of how can we enhance the support we're already providing by bringing digital in at different moments. And we constantly check that and refine it for each person, just as we would with any other aspect of support. Next slide, please. And our latest piece of research then, Bridge or Barrier, where that really came from was our real interest in the fact that over the past kind of 4.5 years of our research now, health and well-being and managing that online has never really appeared to be a strong hook for the people we support. It's never been that motivating factor for someone to get online. And so we wanted to learn a wee bit more about that. So we're really grateful to be supported via the Digital Pioneers Progress Fund by the Scottish Government to carry out this research. And we conducted focus groups with frontline support practitioners at Cargom, so 24 in total, and one-to-one conversations with people we support who, importantly, were already online in some form or other, and that was a total of 27 people. And those one-to-one conversations were conducted by the same support practitioners that took part in our focus group research. Next slide, please. And what we sort of looked at within that research was people's attitudes towards getting online to support their health and well-being generally, but we also looked at 3 specific platforms that are currently available for supporting health and well-being to gather folks' feedback on those as well. So we looked at Near Me, Daylight, which is an app that's free for everyone in Scotland via the NHS for managing anxiety and worry. And also We Are Undefeatable, which is a website made by a partnership of large national health charities to support people living with disabilities and long-term conditions to find accessible forms of movement. Have the next slide, please. And what we found was that digital health and well-being really isn't a strong initial hook for people we support, but 59% of people reported being interested in learning more with someone they trust. And crucially, you're more likely to report being interested in exploring that area if you rated yourself higher in digital confidence. So suggesting there's a wee bit of a needed kind of baseline of digital confidence before you see the potential benefit in digital health and well-being. Have the next slide, please. And this is just some kind of illustrative quotes here. I won't kind of read them out for us, but just kind of leave them on the screen and just really try to kind of represent that people we support were really clear in seeing the potential benefits of digital health and well-being and exploring those routes, whether that was being able to achieve a goal that you had, like attending the gym, but before going physically was too much of a barrier, or just being able to know that you can have quite a complex discussion with a health professional in the comfort of your own home as well, and not having to worry about that travel component. Can I have the next slide, please, Lynn? And a real kind of core bit of feedback from our support practitioners is that they feel uncertain about what digital resources and services are even available to support the people they work with. So none of the 24 support practitioners involved in this research were aware of NHS Near Me, for example, being an option that GP surgeries that they support people to attend were offering to people. So there was a real sort of kind of sense of uncertainty and really just being unaware of what was available in the local area due to potentially a lack of availability or one in terms of the promotion there as well. Have the next slide, please, Lynn. And this, I think, was captured really well by this support practitioner who was reflecting on the differences since COVID, where there was really this push for digital delivery of health and care services, and now starting to see that pull back and it really not being as widespread as what it was before. Have the next slide, please. And really the kind of core thing for us is that people we support and support practitioners reported concerns about this move towards digital first and digital by default. Can I have the next slide there, please, Lynn? And that point was really for trust for some people. So a sense of our in-person relationships with health and care professionals are building up that trust over time, but then also a sense of that digital delivery in itself not feeling maybe as high quality as actually having a conversation with a professional in real life as well. Have the next slide there, Lynn. And also for support practitioners around about not really seeing digital as being the time saver as it's often spoke about. For our support practitioners, a lot of the people that they are supporting would still need assistance to engage with these digital routes. So it's not actually saving time in frontline social care services. And it's also dependent on how confident that staff member is feeling in their own digital skills as well in order to make that a reality. Can I have the next slide, please, Lynn? So really the key takeaways for us then is that digital inclusion support must be appropriately funded and resourced to enable engagement with digital health and care services. We've seen that 59% of people with support were interested in exploring that area with someone they trust, but importantly, that was the people who are already feeling more digitally confident. So there needs to kind of be that baseline that someone's supported to build up their digital skills and confidence first before exploring this area. Crucially though, so frontline social care services are not currently commissioned or contracted across the board for providing digital inclusion support. So there is that big gap there. We know the impact that it can have, but we need to be appropriately resourced in order to deliver that. There's also those inconsistencies in the availability of digital health and care services. So there needs to be that kind of greater sense of kind of equal opportunity of being able to access these routes if you want to, and appreciating digital as an enhancement to the existing trust and support relationship rather than a replacement, and really going kind of head first into this digital by default or digital first route. And just my final slide there, please, Lynn. And really, if we place this into the context of looking forward as well, so the Health and Social Care Service Renewal Framework has recently been published and has an explicit digital principle in there that does great work in recognising the importance of embedding digital inclusion support in frontline services. But again, we need the funding and the resourcing to make that a reality. And also with great kind of innovations coming forward now, like the digital front door, it's really crucial that people accessing social care support and those networks around them of social care staff are meaningfully consulted in the design and the development of these types of services as well, to make sure that they work for the most digitally excluded. And I've just got one kind of final signing off slide where you can scan the QR code there for the full Bridge or Barrier report. And I'll also pop that in the chat for us as well. And if you have any questions at all, please feel free to get in touch. I'll also pop my email in the chat there for us. But thank you very much, folks.
Absolutely fantastic. Thank you so much, Shannon. And there's a couple of things I just want to mirror. The staff skills and ability to support digital technology is so important. And that's something we see and Trust speak about very often. And the same message we give constantly is that digital technology is there to enhance, not replace that human interaction, engagement, and relationship. So I really took that away. So thank you very much. Really interesting. Is there any comments or questions in the chat before we move on? No, I think we're all good. I'd definitely recommend people to scan the QR code or link, hit on the link and read the report. It's very interesting. Thank you very much. So now we're going to be moving on to Murray Davis and Robin Elliott from East Lothian Council. They're going to be speaking about My Story app. So when you're ready, I'll just hand over to you.
Thank you. Murray,
Yeah.
are you here?
Yeah, so good morning, everyone. We'll start again. That's some of the time gone already. I'm here with Robin and Kira from East Lothian talking about the My Story app and practice framework. This has been developed in Scotland with care experienced young people, social workers and carers. Next slide, please. And it matters. It's been in response to young people in care lacking tangible evidence, photos, journals, keepsakes about their experiences and time in care. And this is not new. Some 20 years ago, we did a survey of 24 authorities asking care experienced young people about their life story resources. And 20 years ago, this was an issue for them, and it remains an issue. There are nearly 12,000 children and young people in care in Scotland, and 2/3 of those will experience at least one placement move during the year. Each move deepens their trauma. And many move without evidence of their own life or it's been lost. And what they say is that their childhood is not valued enough to be remembered. Next slide, please. And interestingly, there is no record of which or how many children and young people have life memory resources. This is just not counted at all. The National Institute for Health and Care Excellence has identified the concern about the lack of life story resources, and it's an area that's often neglected. And what, even though it is a policy and good practice, what care experienced young people say is that the absence of photos and stories is one of the most painful losses from their childhood and experience in care. So through my story, the intention is to do something about this. So over to Robin.
Good morning, everyone. I'm Robin Elliott. I'm the team leader in the Adoption and Kinship team in East Lothian Council, and I'm excited to join Murray and Kira's coming along as well to share our journey piloting My Story in partnership with Viewpoint. It's been a bit of a journey to get here, but we're here now, and we officially launched the app with our service in May. So why life story work matters. So we think it's a vital part of helping children and young people understand their past, make sense of their present, and feel hopeful about their future. But we know that traditional therapeutic life story work can be intense and time consuming and sometimes difficult to sustain across multiple placement moves. So that's why something like My Story is an excellent kind of opportunity for us to kind of help young people and children create a thread through their lives. Next slide, please. So why we chose My Story. So the opportunity arose to pilot it around maybe a couple of years ago now, but and we jumped at it. So our aim is to make life story work more accessible, more natural, more embedded in everyday life. So we want our social workers and our carers and people who are working with children and young people every day to, kind of build the narrative and the story with the child. And the app allows carers and workers to capture everyday moments, photos, videos, journal entries, and that can help build the child's narrative over time. Next slide, please. So we're encouraging carers to build the relationship, to use the app, not just to record milestones, but to build the conversation. It can be a conversation starter, a way to help understand a child's triggers, perhaps, get to know about their past before, if they've arrived from maybe several different placement moves. The carer has they'll have a bit of a backstory, hopefully. It's getting to know the child behind the file. And sorry, next slide as well, please. Thank you. It's kind of beyond just a photograph, a digital scrapbook. It's a therapeutic tool. Well, we feel that's how it could be developed and used, and it's got the potential to be a therapeutic tool. If it's used to its full potential, it'll empower carers and workers to really engage in life story therapy that's organic and child-led. And children and young people can use the app privately if they want to journal. It could be a safe space to express themselves. They don't have, they can ask their workers and not to be part of, not to see what they're recording if they want that. So I think this could be especially powerful for children and young people who've maybe experienced multiple placement moves, and just help them build their identity and gives them continuity and connection to the people that are caring for them. So next slide, please. I'm going to hand you over to Kira, who is one of the social workers in our fostering team, and she's really been the technical whiz kid with this and helping us kind of introduce this to our foster care network and to the wider audience in the council as well. Kira, are you there?
Thank you. So the purpose really of the app is, from our sense, is that it's going to be a timeline of the full child's journey. It's not going to just be documenting, you've had a move here, you've moved house there. It's going to be everything in between as well, the kind of small achievements, big achievements, any people who they've come across, made relationships with, maybe other young people in the foster family or whoever. That's going to, hopefully going to be a full added picture to show everything that's happened. And it's not just going to be, you know, I think we're in an era where we've got loads and loads of photos on our phones, but this is going to be a move to try and actually keep something that means something. Who was that? Where were you? How were you feeling? How was that for you? So we're encouraging there to be as much as we can get on the app and recording as much as we can in terms of the tiny wee bits of young people's lives as they go through their childhood and into their adulthood. Next slide, please. The way that it's set up is that each young person has their own account, and within that we've then got foster carers having their own accounts, and we then link the children to them. So the benefit of that is that the children then, this story will move with the child if they were to ever move, or if they have then take that into their adulthood, they've got their own account that's just for them. It's got everything that they need in it. And say there was a short break carer, they could have their own account and they could be linked to the young person so that they can see and they can add things that are meaningful from the time that they've spent with them. We've also got social workers and key workers that have their own accounts, and again they're linked with the child's account, so everyone who is involved and important in a child's life is able to contribute to the story and make it as meaningful as they possibly can. And again, that can be, as Robin mentioned, it can totally be down to the child. If they want their social worker on it, if they don't want their social worker on it, we can work with them in terms of who would be important to see their story and how do they feel about that. Next slide, please. This is a bit about how the app actually looks. It's really, really straightforward. It's really user-friendly in terms of this is something that everybody can use. It shows you exactly what you need to add. There's opportunities to add photos, videos, documents, if there was school reports, if there was anything that was important, that can all be added in. So it's not just going to be a photo place, it can be every part of that. There's then the opportunity to add a bit more in terms of who was there, what happened, what was the achievement that they're doing in the photo, because sometimes a photo might not be as obvious as it could be. So it's got the opportunity to add as much as you can, and then perhaps if the young person's filling it out themselves, they can put in a bit about how it makes them feel, what this photo means for them, and make it a bit more of a personal journey and a journal, as if Robin was saying that as well. Next slide, please. As the app has progressed for us, we have identified that adding the All About Me headings have been helpful and a good way of making All About Me a bit more digital. So we were doing these and we're trying to get social workers and workers to be doing All About Me every 6 months, and we had them paper-based. So we've now added the headings so that there's an opportunity to store them as well, so that they can then show the progress that they've made over hopefully twice a year at least, and have that bit of a check-in and be able to go back and store it. And again, so these things don't get lost if they were to move to another carer. They've got a great background and show a lot of information that might not always get passed on throughout these moves. Next slide, please. So within East Lothian, we've been piloting it with different carers. We've managed to learn a lot in the short term that we've done it. We were able to add on a section for foster carers to have their own diaries. So again, that's taken away from the child's side of it, and they've now got their own accounts where if they want to journal themselves, how's their day been, what are they struggling with, and then their social worker can look into that and prepare for the supervision. So it makes it more meaningful and allows space and time to give their own thoughts and experiences, which is just helpful in terms of that daily logs, getting as much information recorded as we possibly can. Another section that we've added for East Lothian, as we've figured out along the way, is My House Story. And that is when we went to the residential homes and they found that they needed somewhere to store all their photos and memories of everyone who'd come and gone into the residential homes, and it gave them a space to be able to do that. So they're now using that as more of a space for the full house instead of an individual profile, and then all the children have got their own individual profiles. So if they were to go on trips or anything like that, they're able to add that in as well. So that's another adaptation that we've done since piloting it so far. Next slide, please. We are able to download it in a PDF form, and this is allowing us to store it onto our recording systems so that none of the information is going to get lost. it's an easy way for social workers and workers to be able to look at this, get it easily, and print it if it needs to be printed, share with whoever it needs to be shared with, and a bit more accessible in terms of our kind of formal recording aspect of it. Next slide, please. The benefit as well as being able to take that PDF form is that we've got the opportunity now to add this into child reviews and to being able to look at, well, what has the child's journey been? We've met with our reviewing officers to add this into their mindset as well, of to be asking, is this getting filled out? Is it done? And again, it's that kind of picking up the small information, that it's not just these large, say, challenges or positives that have been in the child's life throughout the last review. It's actually all those little bits as well that need to be picked up and are really as important as everything else is. So it's been good to have a full view of everything that the young person's been doing. Next slide, please. So it's, as says, we've made a lot of changes and a lot of adaptations in the short term that we've had it. So it's continuously evolving process that we're doing. It's something that we hope that children and young people are going to continue to add on to. Foster carers are going to get involved, parents are going to get involved, and we hope that this is going to be something that continues as long as we possibly can get it to. And I think that's us. If there's any other questions.
What a fantastic presentation. Thank you, all of you. And, you know, this really hits home how important digital technology can have on people's outcomes and keeping all these memories, but also seeing that bigger picture, getting those children's individual thoughts and feelings can really add to other big emotions or events that give them a bit more clarity. Nikki, do you want to come in? You've got your hand up.
Yeah, thanks so much, guys. That was absolutely great. I was just thinking about training and uptake of using the kind of platform or the app, you know, amongst foster carers or residential staff and social workers. Does that require a bit of effort and kind of, you know, training, or has that been straightforward?
Yeah, it has been quite a long process. Me and Robin have tried to do a bit of a drip feed process through that, of doing smaller sessions with our direct team, then opening up children's services. Then we done a session with foster carers and workers to try and introduce that. But it does take a bit of a push to get foster carers on board with these things. It's change, it's something new, it's quite difficult. So we're hoping we're getting each individual social worker to go out to their own foster families and introduce that, do some support on that, and then once we're in a bit of a flow of it, we'll hopefully do some more training sessions to be able to capture everybody else. And we've done the residential houses as well, just working with their team, but we're hopefully being guided on them in terms of what they feel would be beneficial in terms of the young people in the home. They might want a session as well to show us how that works for them. So we're hopefully just keep going and getting lots of different little bits rather than it just being one introduction and then that's that.
Yeah.
We found the Interact session worked really well. So having people using the app whilst we were present, and Murray came along to that as well, which was really helpful. So that gave people the chance to download the app, upload information, upload a photo, you know, whilst they were with us, so we could help. And I think the people who attended that really got a lot from that session as well.
We had Mary, you had your hand up. Did you put it down? Do you still want to come in? But we've also got 2 questions in the chat, which I'll give Mary a minute if she wants to come back in. Okay, so I have a question here from Monica. I love this. I used it in early stages in West Dunbartonshire Council. I'm wondering how you've managed consent from birth parents or consent from having pictures of young children in the home that might be looked after that are unrelated. Does anybody want to answer that one?
Yeah. So we actually, so someone said it's available in Glasgow. We actually met with Glasgow on Monday, so to kind of do a presentation with them, and so I think it is coming to Glasgow. And they asked the very same question about GDPR and consent, and I think it is just having that open conversation with you know, birth parents about, you know, this is just a different way of recording the information. We have been recording information over, you know, for many years, and this is just a different way. And actually, if it's appropriate, there might be opportunities for them to have some access to that as well. In terms of, what was the other bit of that question?
Other looked after children in the house.
Yeah, so we've we've had the conversations with foster carers about just being careful what they upload, because obviously some of them had some worries about even their own identifiable features of maybe where they live and things. So it's about being mindful of that when they are uploading pictures and who does else have access to it. And I guess it's probably about, having those open conversations with children and young people, what they are recording as well, and yes, consent about if it's appropriate. But actually, if this is a child moving on from a placement, they might, the child who's in placement with them might feel like a sibling. So it's about, that might be really appropriate for them to have a photo of that child and that memory in their app. So I suppose it's just about everybody being aware that that's what's going on and what's the open conversations.
Okay, thank you. And we'll do
yeah, sorry.
Oh, sorry, Robin.
No, it's fine. I was just going to say about the nursery setting.
We'll move on. Our support looked after children within a nursery setting. Would it be something I would be able to get involved with as a senior to ensure the children have memories at nursery shared, examples hitting milestones, trips, graduation photos?
Yes, definitely. We're introducing it with our early years nursery. And they, definitely, especially if we're using the nursery for family time and things like that as well.
Fantastic. What a great opportunity. There is one more question. So if anyone wouldn't mind jumping in the chat just to answer that, I'd really appreciate it from Marianne. And then we're going to be moving on to Pain Check with Nikki and Peter. So I'll hand it to you two.
Thanks, Candice. So I'm Nicky Cronin. I'm a Senior Improvement Advisor for Digital with the Care Inspectorate. I'm also with Peter McClatchin today from the Simon Community Managed Alcohol Project, who will also be speaking about his experience with this technology. So using technology to assess pain, that's really the heading for this work, and the app we've tested is called Pain Check. So for those that don't know, it's an app-based technology or a medical device in your pocket, registered for use in the UK. Uses facial recognition technology and AI to determine a sort of pain score and also pain domains that the person carrying out the pain assessment can observe. So they would record their observations in these other domains along with the facial scan as well. So it can be fully integrated into existing sort of digital care systems, clinical record systems, and it's documented at the point of care. So it'll take that pain assessment score over time, and that can be viewed by care staff or management. So just moving on there, please, Lynn. So just a wee bit from the kind of literature about it. It was initially developed for pain in elderly care with dementia, but I believe it's gone through authorization for children, pre-verbal, and also kind of learning disabilities as well. But focusing on kind of dementia care, really some of the messages are that as a person's dementia progresses, the prevalence and intensity of pain increases and the ability to express this diminishes. So it's a very dynamic, it's a fluid process which adds to the complexity of assessing pain with people that can't reliably self-report. So often under-recognised and untreated in people with a cognitive impairment, and up to 80% of people with dementia regularly experiencing pain in care homes. Moving on, please. So the Care Inspectorate pilot, what have we been doing? So this has been a Scottish Government funded pilot. The licenses have been funded from the TECH programme. Basically, we're implementing Pain Check to a number of test kind of sites, care home sites initially in Scotland, and we're providing support around implementation and kind of ongoing support in terms of using the technology. So in the team, it's been myself, a social work background. We've had Duncan from Pain Check supporting us along the way. So he was nursing background and a registered care manager in Scotland, and experience of using Pain Check. as a care provider. David Marshall was in the project. He was looking at, he's our pharmacist and the care inspector, you may know. So he was looking at medication. And Nicola McCardle as well. She was a physiotherapist with a specialism in falls and frailty. So we had quite a sort of professional team and the improvement team, and also all the care services that we've worked with over time, which would have been mainly care homes, but also care at home. And Peter today, he's from the Managed Alcohol Project, which was something different as well that we did in phase 2. So really what we're measuring pain assessments over time, pain assessments with pain as well, also medication usage, prescribed, and PRN, analgesia, along with antipsychotics that would be used in care homes. So looking at MARCHARTs really and measuring the impact over time with that, and also some quality of life measures. So really looking at the impact on falls, the impact on BMI scores, and dependency scores within care homes as well. So these are some of the quality of life measures we're looking at. So just moving on, please. That's just a kind of summary so far. So 21 care services across Scotland in phase 1 and 2. One of our interesting findings is that there was no documented pain assessments at baseline. We're looking at baseline data. We did 9,693 assessments across these test sites, and about 22% showing pain. 224 different assessing users. So that would be care staff and nursing staff. I think previously, mainly this would have been the responsibility of nursing staff, but I think with this technology, it's quite easy to learn, and you don't need to have that training and the sort of pain assessment. Previously that would have been Abbey Pain Scale potentially. So care staff can get upskilled in using the app and use that. So that was increasing the number of different assessing users. And we did find that although we had some really good data from the sort of 5 services that completed the 9 months test period, a lot of services did lack the digital foundation. So really just the kind of, good quality Wi-Fi, the staff kind of skills and the devices really to make this success of the project, and also the staffing pressures on the sector as well definitely played its part. Just moving on. So as well as ruling pain in, you can rule pain out with the technology. So this is just really in one service. If you just look at the graph actually down the bottom left, you can see during baseline very low pain score, and the PRN pain medication was discontinued. And then as you go through the test period over time, moving left to right, you'll see that the pain scores have increased and the PRN analgesia has been reintroduced. So that's just, we saw lots of examples of this, and we kind of called that pain medication optimization, because it was ruling pain in as well as out. So just moving on, please. This is for one individual, a kind of case study, if you like. So no sort of pain scores in baseline in the left of that graph. Started using Pain Check, sort of moderate pain scores, introducing the PRN analgesia on the graph on the right-hand side. Correlating pain scores moving down towards the right-hand side of the graph. And in terms of quality of life, what you could see in baseline, we had 6 instances of stress and distress across the initial 12 weeks of baseline, and then during the test period, 4 instances of stress and distress in the 24-week period after that. So you can see that, if you look at stress and distress and the correlation to pain, this has been quite a positive outcome for this individual. Next slide, please. These are just our actual results. So these are the 5 services that completed the test period, looking at fall, stress and distress, BMI and dependency score. And these can be summarised really at the bottom there across those 5. There's a 23% reduction in falls for this sample. 51 maintained or increased BMI, which was high. You'd probably expect less for this group. And 50% maintained or decreased dependency score. So really encouraging findings where the technology has been used. That's what we would kind of say, I think. So next slide, please. Just going to hand over to Peter just to talk a wee bit about his experience in the pilot. Thanks, Peter.
Yeah, okay, thanks everyone. Thanks for having me. So I'm Peter McLachlan, Service Lead at Simon Community Scotland's Managed Alcohol Programme. So just to give you a wee bit of kind of a background about the service. So it's the first service in Scotland that work with homeless men that's alcohol dependent, men that's tried different interventions, different treatment, but they still wish to continue drinking at safer levels. They've got a history of A&E admissions, rough sleeping, involved with criminal justice. So that's a kind of a wee bit of the background about the service. So it's quite a challenging service, and we work at very much a high tolerance, harm reduction approach. So we first trialled the pain check, and I think it was in February 2024, because a lot of our men, they only talk about their pain when in A&E. So this gave us a great opportunity through therapeutic relationships, working with the men and having the discussions run about their pain. So I'll talk about a case study. Jim's not his real name. So Jim had a long history of rough sleeping, in and out of B&Bs, attempted suicide. He needed hip surgery, so he wouldn't really talk about his pain. But however, with this assessment tool, with the AI pain check, we were able to probably initially gain his trust. He'd been to the doctor previous times for stronger painkillers, and basically the doctor says no, because you're historical drug use. So through the months that followed, using AI pain check, we were able to gather the evidence with his care manager and get back to the GP, and he was given stronger painkillers. And interestingly, his alcohol reduced as well during that period of time. So he said that he felt as though he was in more control of his life. People were starting to listen to him. He had their relationships, strong therapeutic relationships with the staff here, and he felt ultimately that the staff were starting to listen to him and other services, especially primary care services. So currently, just now, he stopped drinking. He's not had a drink now for 3 to 4 months. He's first on the waiting list to get his hip operation. He's only taking his painkillers as and when required. So part of that process, AI pain check played a big part in it, and it was about building their relationships, getting back to his GP, getting the right painkillers that suited him, and he was able then to reduce his alcohol. I took him yesterday, some bloods taken yesterday at the hospital, and he's got a healthy liver, whereas before his liver was verging on cirrhotic liver. So, and now he asked if we could get him access a laptop, and we've done that, and now he's completing his housing application form. So the feedback from the staff said it was new to them. So, how do we work this? So we got plenty of training. There was plenty of support from Nicky and his team. Yeah, and it was a great experience, and especially for Jim, it's been a great outcome. So, and in his words were, he said, I've got a better quality of life now, and I feel as if I'm in control because people started to listen to me, whereas before he was isolating himself, nobody will listen to me, and it was a wee bit kind of a dubious to AI pain check. So spending time with it, this is what we can do with the evidence. We can go back to your doctor, and it worked for him. So yeah, it's been a positive experience for him. Yeah. Any questions or anything?
Thanks so much, Peter, for sharing that story, and thanks to Jim for allowing us to share that story anonymously as well. I think there was a question. Is there a question? I'm not sure. I can just go through.
There's two in the chat there, Nicky. Can you see them, or do you want me to read them out?
Yeah, do you know what? I'll just finish off and then
Okay.
I'll take them. Candice, thank you. Thanks, Peter. Next slide, please. Yeah, that's just actually elder homes that was brought to our attention. They've been using pain check, and the inspector we didn't know about this service, and the inspector didn't know about our pilot project either, and they found this technology in an inspection last year, and they just kind of reported on some of the outcomes. But we are finding, you know, our scrutiny colleagues are more aware that there's no sort of documented pain assessments in practice. So that's something that, you know, our chief inspectors raised with scrutiny colleagues as well, just for awareness. And that was something that certainly we identified out this pilot. Next slide, please. So key learning. So we were doing this across a number of years with lots of different services. So we've tried to kind of summarise what we've learned. Really, I think this is applicable to lots of digital quality improvement projects. I would say that leadership's really key to driving, you know, digital implementation of a digital solution in a care service. It doesn't seem to have worked in any other, you know, example where someone else is driving it and it's kind of left. It has to be, you know, supported from the top and embedding that sort of digital mindset and culture into the service. That's where we've seen it work best. Staff motivation and engagement to engage with something like this increases as they can see the outcomes. So we saw lots of examples where staff were, you know, actually seeing where it could be useful, and then they would be, you know, looking to use the technology first, almost because they could see the benefit of it. And that, I think that applies to lots of, you know, other technology being implemented in the care sector. Phones we found were better for point of care assessments. Again, we had services with tablets, just not as handy. They tended to sit in drawers more or not be as accessible. So it's just worth thinking about, you know, for any other kind of digital improvement that phones can be carried around and used at that point of care access. We've training and relationship building throughout the project was key. We really upped that in phase 2 of this trial. The benefits of digital foundations, yes. So if you have those digital foundations, digital mindset, the skills and the staff team, you know, the support from leadership and good quality Wi-Fi and all those foundations, then you'll be able to take on projects like this and other projects. So that's really the key. We felt is having those foundations in place. And Peter alluded to the GP engagement there, which I had forgot to mention, and that was key, obviously, in Jim's case, where they were able to take the pain. We've got information, we were providing GPs and social workers about the pain technology, but, you know, doctors are interested in it, the GPs were interested in it, many support it and understand the technology, and they're able to use that data to then inform their prescribing, and that's where you can make real progress, as Peter spoke about. So I think that's me.